I would like to welcome our listeners to this podcast organized by the American Heart Association, aiming to discuss key issues presented in an American Heart Association Commission statement on AI and cardiovascular disease. My name is Antonis Armoundas. I'm a principal investigator with the Division of Cardiology at the Massachusetts General Hospital and also an associate professor of medicine in Harvard Medical School. I also serve as an affiliate member with the Broad Institute at the Massachusetts Institute of Technology. I have served as the chair of this statement, and together with my vice chair, Dr. Sajeev Narayan from Stanford, we had the opportunity and pleasure to work with an impressive and diverse group of international authors that are experts in their respective fields to put forward this statement. I would like to thank this writing committee for their remarkable effort and also the American Heart Association for commissioning this statement. And at this point, I would like to introduce a key author in this statement, Dr. Jennifer Hall.
Hi, everyone. It's a pleasure to be with you today. As Antonis said, my name is Jennifer Hall, and I serve as the Chief of Data Science at the American Heart Association. I'm also an adjunct professor at the University of Minnesota, and we look forward to talking with you about this paper today. Antonis, do you want to introduce to the audience why we wrote this paper?
Jen, this was the first American Heart Association's scientific statement, specifically addressing the role of artificial intelligence in cardiovascular disease. During the last few years, we have observed a rapid acceleration of scientific papers on healthcare-related AI research that has been propelled by massive investments by academia, industry, and global governmental agencies. However, implementation has been challenging. This statement identifies best practices, gaps, and challenges in the application of artificial intelligence in cardiovascular disease. And for each area covered in the paper, we present a table identifying those best practices, gaps, and challenges. Jen, what are the highlights of this statement?
Thanks. One of the big highlights is the central figure or the central illustration. And this is figure 1 in the paper, and it really does walk you through all of the areas that will be covered. It really takes on the patient from their journey, from the minute they step into the hospital to everything that they may have done and work with the healthcare team, all the way to behind the scenes into the legal issues. We talk about, for example, imaging, maybe electrocardiology. We serve several papers in the manuscript which talk about in-hospital monitoring, as well as implantable and wearable technologies. We also discuss genetics and really try to provide a framework for the successful implementation of AI, which is a tricky thing to do. Antonis, how far have we come?
Jen, a plethora of algorithms has been developed and published, yet as we see by going through this literature in this paper, a handful of them have been adopted in clinical practice. To address this gap, we have assembled and presented for each area of the manuscript key practices as well as gaps and challenges, and we will focus, I think, on 2 of them today. Jen, would you like to present the in-hospital monitoring?
Sure. I think what you mentioned before is worth mentioning again, and that is there has been so much published in the last few years on predictive algorithms using machine learning and AI, but very few have been implemented at the bedside or through the electronic health records. And that's because it's tricky. And there are challenging ethical things we need to keep in mind for the patient. So I'm happy to walk through one of the tables in the manuscript, which is in-hospital monitoring. And it provides an example of many of the tables that are discussed in the manuscript, which provide best practices, gaps, and challenges. But I think before I do that, it's worth reiterating that many published papers list predictive algorithms and ways to use machine learning and AI to predict cardiovascular events. But the number of those algorithms that have been implemented bedside to actually help patients is very, very small. And that's because it's tricky and it's really challenging. So part of the paper will address that. But I want to walk you through one of the tables, and that's in hospital monitoring, and you will find it within the manuscript. One of the areas that it talks about in terms of best practices is remote sensors. In other words, could we use remote sensors to help patients predict their cardiovascular events, predict for the healthcare team what may be happening to them if they would enter a sepsis event or something similar? And would it help the patients to perhaps rest better and be more confident and less anxious if there's a lot of beeping sounds rather simply a remote sensor that they wore that alerted the healthcare team? Some of the challenges in this area are, of course, what Antonis described before, which are how do we make sure everyone has access? So, with that, I'll turn you over to Antonis, who will talk through another table on electronic health records.
Thank you very much, Jen. Although there has been a plethora of algorithms applying artificial intelligence on electronic health records, and that has been primarily for disease classification and prediction of adverse disease outcomes, I would say there is a shortage of prospective studies validating the accuracy of these algorithms. Investigators also have to use the largest and best curated electronic health records to develop these algorithms and ensure the accuracy and generalization of these algorithms across diverse patient cohorts, including those in remote and underserved areas, thus helping avoid exacerbating inequities and perpetuating bias of the algorithms. A third point that I would like to make is that we should pay attention to integrating electronic health record data from diverse electronic systems.
Wonderful. Can we get to the key takeaways? I think everybody would be really interested to hear those. Antonis, do you want to start?
Sure. Jen, I believe we live in an Oppenheimer moment. We're all very keen on, interested in using this technology to advance equity of healthcare and improve quality of life for all. Yet we have to be mindful in assessing risks and also the implications of this technology at each step of the implementation. So in this paper, we present a framework for successful implementation that includes all stakeholders, that is policymakers, scientists, developers, clinicians, and we look forward to use AI in transitioning from precision diagnosis and treatment to precision prevention. Having said all of that, we should be mindful that although this statement is up to date, it is likely that 6 months from today we'll have very different issues to discuss.
Let me talk through a few of the calls to action that we feel are really important. Number one, providing a framework for all individuals to begin to access electronic health records and the incorporation of AI and machine learning algorithms to improve health. And providing a framework may simply give guidelines to individuals on how to do it, what to avoid, and what to strive for. Again, best policies and best principles. Secondly, making things transparent. Sometimes we think AI is a black box, and it's not. And so we need to be able to provide all of the data that we used and to provide the code used to write those algorithms. And finally, a call to action for all of you would simply be to take care when you're using AI and machine learning. And of course, we recommend reading this paper. So with that, I'll turn it back to Antonis for some final remarks.
Jen, I would like to thank the Writing Committee again for this remarkable effort. And I hope on behalf of the committee, I hope you have enjoyed reading this paper. I would like also to thank our listeners, and I hope they have enjoyed this presentation.